One of the advances that we've been able to develop out of the use of platelet-rich plasma is a concept called platelet lysate. And if you think of the platelet as being like a little suitcase full of growth factors, that suitcase is actually kind of inflammatory, where the contents are more growth factors that we think are helpful for stimulating the healing response. So platelet lysate basically juices or opens that suitcase, if you will, throws away the suitcase, the sticky part, and keeps the contents of the suitcase available. So you basically juice the platelets, and that platelet juice is very anti-inflammatory but still pro-growth and pro-repair. So platelet lysate is used in places where maybe you don't want to create quite as much of a inflammatory reaction, where you're not necessarily trying to build up connective tissue like ligaments and tendons, but maybe do a function, for instance, in the epidural space, to try to use the enzymes that are in your platelets to kind of eat up the disc herniation material, and also where you may have nerve damage from a disc herniation pushing on a nerve. It helps the nerves to heal. So you have a growth factor recipe that's low inflammation, but still promotes a nice growth and repair in places where you might not want things to be kind of sticky.